Test.com's Cosmetology Practice Test. For complete practice, try our full-length 400-question Cosmetology Practice Exam Kit with fully explained answers, testing tips, and more. Question 1. Different levels of infection control are required in a salon. The lowest level of infection control is called A. Sterilization, B. Sanitation, C. Disinfection, D. Bactericide. B. Sanitation. Sanitation is the lowest level of infection control, as it keeps the area sanitized, which is unfavorable for the growth of bacteria. An example of sanitation would be washing your hands before performing a service. Question 2. The second level of infection control that kills the most microbes is called A. Sanitation, B. Disinfection, C. Sterilization, D. Decontamination. B. Disinfection. Disinfection kills most microbes. Remember, not all microbes are killed in a disinfecting solution. Some form spores not affected by heat or cold. An example of disinfection would be allowing your non-porous tools, comb, brush, shears, to be immersed in a disinfecting solution after using them on a client. Question 3. Susie has completed a manicure. What should she do with the following implements? Cotton, emery boards, and orange wood stick. A. Recycle these non-porous items. B. Discard these non-porous items. C. Discard these porous items. D. Sanitize these items. C. Discard these porous items. Porous items must be discarded since they cannot be disinfected. Question 4. Which of the following is true with regard to the use of universal precautions? A. They are not used on clients who are healthy. B. They are used only on clients who present with symptoms of virus or disease. C. They are used on all clients. D. Both A and B. C. They are used on all clients. Universal precautions are infection control practices that are used with every client. An apparently healthy client may be an asymptomatic carrier, or someone who may be a carrier of viruses or diseases with no recognizable symptoms. For this reason, all clients need to have the same infection control procedures done. Question 5. Communicable diseases are diseases that can be spread from one person to another. An example of a communicable disease is hepatitis B, HBV. What part of the body does HBV affect? A. Lungs, B. Heart, C. Liver, D. Kidney. C. Liver. Human hepatitis B is a highly infectious disease that affects the liver. Question 6. John is putting his Marcel irons away for the day. He accidentally burns himself. What should he do first? A. Immerse the burn in cool water. B. Put ointment on the burn. C. Put a Band-Aid on it. D. Immerse the burn in warm water. A. Immerse the burn in cool water. When an electrical burn occurs, immerse the burned area in cool water immediately. Question 7. When performing first aid procedures for a cut, using a tourniquet is not recommended. Why? A. First aid supplies are not readily available to cosmetologists. B. Tourniquets do not control bleeding. C. It may result in a medical amputation. D. It takes too long. C. It may result in a medical amputation. Tourniquets may result in a subsequent medical amputation and are not recommended. Question 8. John is about to perform the Heimlich maneuver. When performing the Heimlich maneuver, all of the following steps are involved, except A. Pat the victim on his or her back. B. Make a thumbless fist. C. Call 911. D. Determine if the victim can speak or cough. A. Pat the victim on his or her back. Never pat the victim on the back. This may lodge the item further. Question 9. In what year was the OSHA bloodborne pathogen standard created? A. 2011. B. 1910. C. 2010. D. 2001. D. 2001. The OSHA bloodborne pathogen standard was created in 2001. Question 10. The technical name for the study of hair is A. Hairology. B. Anagenology. C. Trichology. D. Trichorexis nodosa. C. Trichology. The technical name for the study of hair is trichology. Question 11. What are the 3 stages of hair growth in the correct order? A. Anagen, catagen, telogen. B. Telogenic, anagen, cataphoresis. C. Alopecia, telogen, kenites. D. Telogen, catagen, anagen. A. Anagen, catagen, telogen. The 3 stages of hair growth are anagen, catagen, and telogen. The active growing stage is called the anagen stage, where the root sheath is attached to the hair fiber. The catagen stage is a quick stage when all cell division stops and the root sheath begins to separate from the hair fiber. The telogen stage is a stage where the hair fiber has no attached root sheath and the hair fiber falls out. Question 12. There are 3 parts of the hair strand. The outermost layer of the hair strand is called the A. Cortex. B. Medulla. C. Membrane. D. Cuticle. D. Cuticle. The cuticle is the outermost layer of the hair strand. Question 13. Due to its ability to lather freely, this type of water is preferred for shampooing in the salon. What type of water is it? A. Hot. B. Soft. C. Hard. D. Lukewarm. B. Soft. Soft water is most preferred for shampooing because it is easier to lather due to it being free from minerals. Question 14. Scott is performing a scalp analysis on a client. Scott notices bald areas with small black dots, some round scaly areas of dry skin, and a couple of pus-filled sores. What does the client likely present with? A. Tinea corporis. B. Tinea capitis. C. Tinea pedis. D. Tinea cruris. B. Tinea capitis. The client presents with what appears to be ringworm of the scalp, called Tinea capitis. Tinea corporis is ringworm of the body. Tinea pedis is of the foot, and Tinea cruris is of the groin. Question 15. Shampoos with a high pH level may cause hair to A. Become dry and brittle. B. Soften. C. Have increased shine. D. Darken. A. Become dry and brittle. Shampoos with a high pH may cause hair to become dry and brittle. Question 16. The Marcel iron was invented in 1875 by A. Gabriel Marcel. B. Pierre Marcel. C. Marcel Gratteau. D. Michael Marcel. C. Marcel Gratteau. The Marcel iron was invented by Marcel Gratteau in 1875. Question 17. When using a stove-heated Marcel iron, you must test the iron on this type of paper to ensure the iron is not too hot for your client's hair. A. White paper towel. B. Brown paper towel. C. White cloth towel. D. Brown cloth towel. A. White paper towel. Test the iron on a white paper towel. If it turns the paper towel a color, it is too hot to use on your client's hair. Question 18. If the ends of hair protrude over the top of the Marcel iron, the following may result. A. Creased ends. B. Fishhook ends. C. Fish ends. D. Crokinole ends. B. Fishhook ends. Fishhook ends are the name given to crinkled or creased ends, caused by allowing the hair end to stick out over the top of the iron. Question 19. When using a pressing comb, this part of the comb straightens the hair. A. Teeth of the comb. B. Your hand. C. Wood handle. D. Spine of the comb. D. Spine of the comb. When performing a hair pressing service with a pressing comb, it is the spine of the comb that straightens the hair. Question 20. What are the three components of a pin curl? A. Curl, balance, stem. B. Circle, stem, curl. C. Base, stem, circle. D. Contour, base, curl. C. Base, stem, circle. The base, stem, and circle are the three components of a pin curl. Question 21. Angela is performing a haircut. She looks down and notices that this finger controls the stationary blade of her shears. Which finger is it? A. Ring finger. B. Pinky finger. C. Index finger. D. Thumb. A. Ring finger. The ring finger controls the stationary blade of the shears. Question 22. Katie's teacher tells her to elevate the hair when cutting. What is another word for elevation? A. Sectioning. B. Lowering. C. Thinning. D. Projection. D. Projection. Another word for elevation is projection. Question 23. When cutting hair, there are two types of guides that can be used. What are they? A. Stationary and traveling, mobile. B. Parallel and stationary. C. Complete and incomplete. D. Projection and sectioning. A. Stationary and traveling, mobile. The two types of guide used in haircutting are stationary and traveling, mobile. Question 24. Marie is doing a consultation with her client. Her client says that she wants a shag haircut. At what angle would Marie most likely elevate the hair while cutting? A. 0 degrees. B. 45 degrees. C. 90 degrees. D. 180 degrees. D. 180 degrees. A shag cut is at 180 degrees. Question 25. In haircutting, a subsection of the hair is known as this. A. Angle. B. Guide. C. Part. D. Angle small subsection. C. Part. A part is a smaller subsection of hair. For complete practice, try our full-length 400-question Cosmetology Practice Exam Kit with fully explained answers, testing tips, and more. Question 26. According to the color wheel, the three primary colors are A. Red, yellow, purple. B. Yellow, orange, blue. C. Red, blue, yellow. D. Yellow, orange, green. C. Red, blue, yellow. Red, blue, and yellow are primary colors. Question 27. Robert has lightened his client's hair. His client says that she feels her hair has brassy orange tones. Robert decides to use a toner on his client's hair to neutralize the unwanted brassiness. According to the color wheel, what color toner should Robert apply to his client's hair? A. Violet. B. Blue. C. Yellow. D. Red. B. Blue. According to the color wheel, Blue and orange are complementary colors. Blue is used to neutralize the warmth of the orange, brassy, tone. Other complementary colors are red and green, yellow and violet. Question 28. All colors that contain aniline derivative tints require a blank before application to determine if a client is sensitive to the chemicals. A. Patch test. B. Strand test. C. Hair porosity test. D. Hair elasticity measurement. A. Patch test. All colors that contain an aniline derivative tint require a patch test. A patch test involves applying the desired formula to the client's skin, allowing time to process and looking for signs of allergy, such as itching, burning, redness, etc. Question 29. Jane's son, Jack, wants a temporary color for a party he is going to. What type of temporary color would you recommend for him? A. Bleach. B. Spray-on hair color. C. Oxidative with ammonia tint. D. Demi-permanent color. B. Spray-on hair color. Spray-on hair color is classified as a temporary hair color. Question 30. Permanent colors are able to A. Deposit color only. B. Rinse out after one shampoo. C. Lift natural pigment and deposit artificial pigment in a single process. D. Lift artificial pigment and deposit natural pigment in one step. C. Lift natural pigment and deposit artificial pigment in a single process. Permanent colors can lift natural pigment and deposit color in a single process. Question 31. What percentage of peroxide is found in a developer that states it is 20 volume? A. 3%. B. 6%. C. 9%. D. 12%. B. 6%. 20 volume developer contains 6% peroxide. Question 32. Decolorizing hair and recolorizing it to the desired level and tone is called A. A double process technique. B. A triple process technique. C. Tint back. D. Double bleach technique. A. A double process technique. Decolorizing hair and recolorizing it to the desired level and tone is called a double process technique. A double process technique is done when the desired color cannot be achieved through a single process of color. Question 33. When deciding how long a color should process, you should always refer to A. The salon supervisor. B. Salon policy. C. Manufacturer's directions. D. The client. C. Manufacturer's directions. Always refer to the manufacturer's directions when determining how long a color should process. Question 34. Sally has decided she wants a perm. However, she is running a low-grade fever. How should her stylist proceed? A. With caution. B. As normal. C. Do not perform the service. D. Process the perm with shorter times than those in the manufacturer's directions. C. Do not perform the service. If a client has a low-grade fever, their body temperature is already elevated. Elevated body temperatures will speed up the processing time of the perm, causing it to overprocess the hair and may cause damage. It is best not to perform the service. Question 35. The overlap method of wrapping hair for a permanent wave service is also called A. Crokinole technique. B. Spiral technique. C. Bookend technique. D. Double bookend technique. A. Crokinole technique. The crokinole method is also referred to as an overlap method. This involves wrapping the hair from the ends to the scalp. Question 36. When wrapping hair for a permanent wave service, Janet's client has heavy density hair. What size partings should Janet take to allow for even absorption of her permanent wave solution when it is applied to her client's hair? A. Large. B. Medium. C. Small. D. No partings. C. Small. When a client has heavy density hair, it is recommended to take smaller partings to allow for even absorption of the permanent wave solution. Question 37. Which bonds are broken and rearranged during a permanent wave solution? A. Carbon. B. Disulfide. C. Van der Waals forces. D. Hydrogen peroxide. B. Disulfide. During the permanent wave service, the perm solution breaks the disulfide bonds in the hair. Question 38. Todd's client's hair is short. His client wants a perm. Todd needs to figure out if his client's hair is long enough to make a complete curl. To make a complete curl during a permanent wave service, the hair must wrap around the tool how many times? A. 1 time. B. 1.5 times. C. 2 times. D. 2.5 times. D. 2.5 times. In order to make a complete curl when wrapping hair for a perm service, the hair must be wound around the tool 2.5 times. Question 39. A chemical relaxer permanently relaxes curly hair into a straighter configuration. The most common active ingredient in relaxers today is A. Sodium hydroxide. B. Sodium disulfide. C. Sodium calcide. D. Guanidine. A. Sodium hydroxide. The most common ingredient used today in relaxers is sodium hydroxide. Question 40. Kara, a client, wants a sodium hydroxide relaxer. During consultation, her stylist finds out that Kara had an ammonium thioglycolate relaxer service done on her hair last week. How should Kara's stylist proceed? A. Proceed with care. B. If it was last week, it should be okay. C. It will be okay after a good shampoo. D. Do not perform the relaxer service. D. Do not perform the relaxer service. Ammonium thioglycolate and sodium hydroxide are completely incompatible. The client must wait until her hair has grown out from the hair that was treated with ammonium thioglycolate. Question 41. Is the use of an overlapping relaxer recommended when performing a retouch relaxer service? A. Yes, as it will help improve shine. B. Yes, if the hair is curly. C. Yes, to provide texture to previously relaxed hair. D. No, as it may cause damage to hair. D. No, as it may cause damage to hair. Overlapping relaxer may cause damage to previously relaxed hair and is not recommended. Question 42. Jill has rinsed her client's relaxer out. She needs to lower the pH level of the chemical relaxer. What kind of shampoo should Jill choose? A. Volumizing shampoo. B. Conditioning shampoo. C. Neutralizing shampoo. D. Texturizing shampoo. C. Neutralizing shampoo. Neutralizing shampoo is used to lower the pH of the hair after a relaxer service. It also reforms disulfide bonds, making the hair permanently straighter. Question 43. The skin has 3 main layers: the dermis, subcutaneous, and the epidermis. The epidermis is the blank layer of the skin. A. Innermost. B. Bottom. C. Middle. D. Outermost. D. Outermost. The outermost layer of the skin is the epidermis. Question 44. Eric's teacher says that the pH of hair, skin, and nails falls on the acid side of the pH scale. The pH of hair, skin, and nails is A. 8 to 10, B. 5.5 to 6.5, C. 4.5 to 5.5, D. 3.5 to 4.5. C. 4.5 to 5.5. The pH level of hair, skin, and nails is 4.5 to 5.5. Question 45. When doing a client consultation before a facial, Erin notices that her client's face is a bit flaky on the sides while the center around the nose is oily. What skin type does the client most likely have? A. Oily. B. Combination. C. Dry. D. Sensitive. B. Combination. The client most likely has the combination skin type. The combination skin type typically presents with dry and flaky parts while the center of the face, nose, chin, and forehead is oily. Question 46. The white half-moon shape at the base of the nail. A. Perineum. B. Free edge. C. Lunula. D. Hyponeum. C. Lunula. The white half-moon shape at the base of the nail is the lunula. Question 47. When referring to disorders of the nail, onychophagy is more commonly known as this: A. Torn nails. B. Nail fungus. C. Missing nails. D. Bitten nails. D. Bitten nails. Onychophagy refers to bitten nails. Question 48. While performing a manicure on a client, Tom cuts himself. What should he do immediately? A. Stop the service and begin blood spill procedures. B. Wrap a tissue around the cut and keep working. C. Put on a bandage and have the client finish with another technician. D. Terminate the service and seek medical attention. A. Stop the service and begin blood spill procedures. If a technician gets a cut while performing a nail service, the service must be stopped immediately and blood spill procedures followed. After proper procedures are complied with, the technician can return to service. Question 49. The epidermis contains 5 layers of skin: stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum germinativum. Which layer is the lowest where cell growth occurs through mitosis? A. Stratum granulosum. B. Stratum germinativum. C. Stratum spinosum. D. Stratum lucidum. B. Stratum germinativum. The lowest level of skin where cell growth occurs through mitosis is known as the stratum germinativum. Question 50. On average, how long does it take for a new nail to grow? A. 2 to 3 months. B. 2 to 3 weeks. C. 4 to 6 weeks. D. 4 to 6 months. 4 to 6 months is the amount of time that it takes for growth of a new nail to occur. Thanks for watching Test.com's Cosmetology Practice Test. For complete practice, try our full-length 400-question Cosmetology Practice Exam Kit with fully explained answers, testing tips, and more.